It's Family Health Experts on this edition of WPSD Local 6 Midday. If you'd like to give a call and give a question to Dr. Tony Milliano of the Audiology and Hearing Center, the number is on your screen, 1-888-208-6946. And we do have a question already, and somebody is asking, hey, why is testing at an audiologist different from a regular hearing screening?
That's a great question because a lot of people really don't know and understand the difference. And the difference in an audiologist is that as an audiologist, we have 4 years of college education and 4 years of doctoral training to be a doctor of audiology. So we're looking to find out not only if you have a hearing loss, but why, find out the underlying cause, find out the etiology of the hearing loss, and look at all of the treatment options available, including medical or surgical treatment. So it's a much more in-depth evaluation.
Okay. Maggie says, I'm not that old, but I can tell a definite loss in my hearing at this point. And I guess there is no specific age at which hearing loss can occur. But she wants to know, will your testing tell me what caused my hearing loss?
Yeah, that's similar to the question that we just answered a moment ago. As a doctor of audiology, that's one of the main things that we do is look for not only if you have the hearing loss, but also the cause of the hearing loss. And then once we determine the cause, that will allow us to determine what treatment options are available. So yes, we certainly do look for the cause.
Jonathan says, I listened to music a lot at a high decibel when I was younger. Am I likely to have hearing loss?
Yes, that is true. Noise exposure and age are both, the number 1 and number 2 causes of hearing loss. So when it comes to noise exposure, there are 2 factors that make a difference. The duration, or how long you were exposed to the loud noise, and also the loudness or the volume, so how loud it was. So the louder the sound is, the fewer hours or fewer minutes you're allowed to be exposed to that particular noise.
Okay, Michael wants to know, after his hearing aids aren't working as well as they used to, he says, do I need to have my hearing tested again?
Yes, that's a good idea. There's a lot of reasons why people would want to have the hearing tested again and consider looking at new technology. Most of the time when we look at updating technology, it's because of either progressive hearing loss, declining performance in their current technology, or advances in technology. We've got a lot of new exciting technology now that includes connection with iPhones and Bluetooth technology, connected wirelessly to your telephones and televisions, all sorts of things like that. So they're constantly coming up with new and innovative technology.
All right, Dr. Tony Milliano is our guest. If you have a question for the good doctor, give us a call, 1-888-208-6946. Got a couple of minutes left. We'll try to get your question in. Now, the next question from Peter says, how long does the testing take?
The testing, again, as a doctor of audiology, we're looking to find out the underlying cause, so it is going to take a little bit longer than just a free screening or a free test, what you might get at other places. The full consultation, once we take your history and talk about the treatment options and so forth, is going to last anywhere between 60 to 90 minutes, so hour to hour and a half.
Okay, we do have an anonymous caller who says, I had surgery that led to hearing loss. What can I do at this point?
Well, it depends on the kind of surgery. It depends on the hearing loss. Surgery, was it a surgery on the ear? Was it a surgery somewhere else in the body? And, the resulting hearing loss because of compromised blood flow or something of that nature. So need a little more information to find out exactly what's going on, but a good first step, again, would be, have a complete evaluation performed and find out exactly what the underlying cause is. And that will lead you to to know what your treatment options are.
We have another anonymous question, and I think you probably get this one a lot, but we'll address it again here as well, and that is the testing covered by insurance? Yes,
it is most of the time covered by insurance. That is including Medicare and all private insurance coverage. We do need to get a referral for Medicare to cover for audiologic testing, but that is a covered service.
Okay, and real quickly, one last question. Will hearing aids help me with the ringing in my ears?
Most of the time it does, because the individuals, most of the time when they have hearing loss, ringing in their ears, they have hearing loss as well. So when we treat the hearing loss, we also allow them to hear sounds better, which will allow them to be less bothered by and manage that tinnitus or the noise in their ears a little better.
All right, Dr. Tony Milliano of the Audiology and Hearing Center has been our guest on today's WPSD Local 6 Family Health Experts. If you'd like more information, see our Family Health section on our web channel, WPSDLocal6.com, and once there you can review this interview and any others that pique your interest. Just click on the Family Health Experts icon in the middle of the page.